So one unique thing that I wanted to make sure that LIV1 had was a connection between a medical provider and a health and performance coach. Basically, you may have heard them more as like a health coach, but we define them as a health and performance coach. So when clients come in, they get their blood work done, they meet with myself or Justin as the medical provider. We go through the labs, we discuss everything, come up with an action plan for them. And then about 2 weeks later or earlier, they meet with the health and performance coach to say like, hey, how was the consult? Do you have questions after? Have you got all your supplementation? Do you have questions on your medications, how to inject, things like that? And they're able to also build a training program and talk about macros. So when we work synergistically together, I can also talk with Tim and say, this is what I'm seeing in the blood work. This is what I'm looking at as maybe that we can maybe work on from a nutrition standpoint, or hey, their cortisol is super high, they're super stressed out. Maybe you need to talk with them about reducing their training load a little bit and talk with them about it from that side of things, because he's the expert in the training and more on the nutrition side of things. And yes, I know some of it and we can talk and have a conversation, but I want to have that expert to talk to the client on nutrition and training. And then they can talk with me about all their blood work, about their medical conditions, or about their health and fitness goals from more of a medical side. And when we work synergistically together, we literally have like our offices are next door to each other. It really makes a huge impact on the client's results. So I'm very proud that we do have that right in person, right next to each other, just to communicate and help the client be successful from several different angles.
Yeah, and it helps with, because a lot of times for those that have not been here, your first consultation, hour and a half, very in-depth, a lot of information, and you're focusing on the blood work and what's going on, what needs to be improved, how we go about that, to then get into the basics of nutrition and working out. It's just too much
It's a lot,
all at once. So that's why, okay, give it a couple weeks, meet with the health coach. Now we go over, all right, any questions from the consult?
Right.
Any questions on the action plan? Have you gotten your supplements, your medications, whatever that might be? Any questions on the dosing, how to use them? Then we get more into the basics of macros, and if it requires a training program, I help them along that way. And this is unique because why a lot of people maybe don't have great success with their the regular healthcare system or their PCP, because they'll go to the doctor, they'll have the consult on average, what is it, 7 minutes in the US?
Yeah.
So it's somewhat of a short consult, and then that's it. And then I don't know, maybe a few weeks, a month later, you might come back in, but you don't have any accountability in between there. And again, coming from a background of chiropractic and now doing this for a few years, food is and can be medicine. If you don't address what people are putting into their body, that will greatly affect their results regarding the plan you have set out for them. Their hormones or medications might not work as well if they don't have those basics covered, and that's my job. That's why I go over with the macros, proper calories, carbs, fats, proteins, because that is one of the biggest things, because I still don't think people truly realize, even adults today, that what you put in your mouth literally becomes the tissues of your body. That's how it works. We are eating calories. Calories are a unit of energy. You are literally eating energy, creating the tissues in your body. And excuse my language, but the phrase is, you eat like shit, you feel like shit.
Yeah.
That's why. You can't eat these highly processed, highly palatable foods all the time and expect your body to function the way you want it to.
Right.
It's not going to happen, never has, never will. And so the client and I look at their diet. I typically, how it goes is we set them up on our app, if they don't already have one, as far as tracking food apps, some sort of tracker. And they track for a couple weeks on their own. I don't really even say anything, because I want them to, number one, get used to tracking if they haven't before, and number two, establish their own baseline.
Right.
What I have found in the past, if I were just to go over their numbers, have the conversation, and give them, hey, here's where I think your macros should be, if they're here and I think they need to be here, that's such a long ways from what they're used to. They felt like they were failing, they couldn't get there. So not only is it a good learning tool to go over their baseline, so this is how you've been eating for the last who knows how many years, decades, which is probably why you feel the way you feel. So here's where you're at. Here's where you need to be. Here's how we're going to get there. So we just slowly, incrementally work our way up to the proper nutrition. This is a very long conversation on macros, but I'll just, on average, most women and men, but I would say about 95% of all the women I've worked with eat such chronically low calories. They don't eat enough to support what their body needs, and you eat under your BMR for years and years and years, and you lower your metabolism. They wonder, why can't I lose weight? I don't, I'm going to eat less, lose weight. That's not how it works in the long run. So we have to increase calories over a period of time. Same with some men, but what I found a lot of men, not to get on a strict macro conversation, but most of my guys hit pretty good protein, but that's all they focused on, because most guys have more of a gym mindset, training mindset. So they know muscle is protein, we need the protein, but they don't look at the other stuff. They're disregarding the carbs and the fats. And for whatever reason, a lot of my guys in my 50s or their 50s that look good, train hard, have for years, they tell me I can't make progress. I can't lose weight. I can't build muscle. I have them track. I give their baseline almost every single time. Protein's equated for, it's really good, but they're fat. Their fat calories are just through the roof, far outweighing the protein calories. And when that happens, you're not going to push the needle forward.
Right.
So to get back to the original topic, I help them with the basics day to day, week to week. And by the time their next quarterly review comes with you, their next quarterly labs, hopefully that work has shown up in the results.
Right.
And then you meet with them, go over the lab work again.
And then when I go over the blood work too, I also am talking about like, so when you're doing these macros and this is what's happening, like I can see if somebody is like, doesn't have any carbs in their diet, a lot of times I'll see a higher SHBG, and then I can refer it back to the lab. So then it makes sense.
There's a big disconnect. Again, they don't realize how the food affects everything.
Yeah.
How your carbs affects your insulin, your cortisol, your thyroid. And
that's a big part of what I want for clients, is them to just have agency over themselves, over their mind and their body, as we all should. And when they start to learn how the food and their exercise are impacting their actual blood work and their in-body scans, and then we'll have them go do some imaging and get like a coronary calcium score or a CCTA or a DEXA scan. Like we have them go do all of these things so they can learn about their body. That's what LIV1 is you learning about your own body. We're helping to provide clarity for you on what that is, because you can go online. There's a million different things. And also just accountability, because we all know, like everyone knows that they shouldn't have all the bad foods. Everyone knows they should have protein. Everyone knows they need to work out, but it's like, how do I do it? And we want to be accountable.
Someone's going to hold you accountable in the regular, but it's almost impossible in the regular healthcare system with your PCP. They're not gonna, and they can't check in with you all the time.
Yeah.
They can't. It's too much, too many people. We have the ability to do that.
Yeah, because we're not constrained by insurance, because we don't accept insurance. And so we can sit and talk with the client for as long as we really need to and check in with them. And it's really, it's the most important investment that anybody can make is in their health, not just for themselves, but for their family and for their future self and their future kids and grandkids and everything else. So, and I think we established that by having both the health and performance coach and the provider working very closely together.
Yeah, getting help from both ends.